First video shoot. These are going to be short. I'm going to try and do them daily. But today is 15 November 2023. So this will be a quick video. I'm just going to document an upcoming surgery that I have, just to do a little bit of history to open this up. I have a spinal injury that caused myself. Learning the fine line between fitness and brokenness. So I have I have ruptured my L5S1, and I have ruptured my L4, L5, and I have herniated my L3, L4. I also have a cyst on my L3, L4 disc. I also have spondylolisthesis, which is when your vertebrae slide forward, typically forward, sometimes backwards, I guess, and misalign. And what ends up happening is the hole that goes through your vertebrae, if you think about it like this, it misaligns and that hole gets smaller. It's a genetic condition that I have. You can have it either in your lower back, your L4, your L5. You can also have it in your cervical, in your neck as well. So I have that, and so when I ruptured the discs that I mentioned earlier, that hole became non-existent basically. So in the middle of your back at about your L3, your spinal cord breaks out into individual strands of nerves. Mine are actually pinched off and retracted a little bit. They're stuck in that grip between the ruptured disc and my vertebrae. As such, I can't really feel my legs, can't feel my feet. It vacillates between neuropathy and no feeling at all. I'm walking on a walker, and I'm using a cane or staff that I have to get up and down the stairs. So I have surgery on November 20th, where they're going to correct all that. They're going to remove the debris from the 3 impacted discs, the 2 ruptured and the herniated. They're going to remove the cyst. And then they're also going to put pins and spacers in place to realign the spondylolisthesis to correct that. Cool thing is, we're going to get a little bit taller out of this. So that's November 20th. So I'm really looking forward to this, because the hardest part of this, psychological. I was pretty active. I lost 40 pounds since the beginning of this year going into this, and I can't do anything. I'm not allowed to drive. Really need to avoid the stairs because there's such pressure on my nerves. If I fall on the stairs or if I get into a car accident, the neurologist and the orthopedic surgeon both said that I could end up paralyzed. So that's a little bit of sobering news when I got that one. But quick notes every day. Surgery is supposed to be an hour, not much, and I have a 6-week recovery. So I'm going to record all of that going into surgery next week, and my recovery afterwards. Walking, which is really all I'll be allowed to do initially, and then getting back in the gym and getting rid of this weight that I've put back on, because all I can do is sit around. Just driving me crazy. But yeah, more to follow. Thanks for listening.